Hi. So this study is looking at patients who are diagnosed with pneumonia in the outpatient setting. The data is looking at patients who are seen in the Geisinger Health System, which is a health system in central and northeastern Pennsylvania. This covers 50 affiliated outpatient practices. Children had to be between 1 and 18 with a clinical diagnosis of pneumonia and seen between January of 2008 and December of 2009. And our question was whether beta-lactam monotherapy compared to macrolide monotherapy resulted in more or less unscheduled follow-up visits. Unscheduled follow-up visits included whether they came back to the outpatient facility 1 to 5 days after their initial diagnosis, whether they went to the ED, or whether they were hospitalized. What we did analysis is this is our patient population before we matched on propensity score and asthma. Once we matched, you can see a better balance of our covariates. So we still have more of the younger age group, 1 to 5, and 6 to 18 years. But they're matched on what monotherapy they got within each age group. What we found is that children who were 1 to 5 years old had no statistical difference in whether they had an unscheduled follow-up visit, whether they had macrolide monotherapy or beta-lactam monotherapy. The older age group, so children 6 to 18 years of age, children who had macrolide monotherapy were less likely to have an unscheduled follow-up than kids who had beta-lactam monotherapy in that age group. And we think this is most likely due to the fact that mycoplasma pneumonia and other atypical bacteria are actually more common in an older age group and much less common in the younger age group. There are several limitations to our study. We didn't know the etiology, so we have no idea whether those older age kids actually had atypical bacteria. We based everything on ICD-9 codes for the follow-up visits. We don't know if the ICD-9 codes in the follow-up visits were pneumonia or not, but we're looking into that. But some of the strengths are that this is a large multi-site study. It included about 1,900 patients. And that we have other clinical findings besides just whether they got diagnosed with pneumonia, things like rales, wheezing, and asthma. And then propensity score allows for adjustment of many potential confounders that otherwise would not be possible with your outcome. Welcome.